If someone's going to say that I have all the answers and this is what you need,
Yeah.
then you need to go the other way.
I brought Dr. Romanzo on today because she and I have actually never met in real life before, but we've become kind of Insta friends because both of us are moms and PTs and runners, and she's just got some cool stuff to say. So I want to make sure that you got a kind of a place and a voice here. So why don't you tell us a little bit about yourself, and then we'll dive into some of the questions that you got.
Yeah, thanks. So I went to school up in upstate New York. I graduated in 2010. And then after that, I went into the military, which surprised some people. And I stayed there. I was in there for 4 years. I worked in the acute care setting at first. So a lot of my patients were all very young guys coming back from the war, just days out from their injuries, waking up in the hospital without limbs. So, and it was the most rewarding experience I could have ever asked for.
That's amazing.
And then I deployed. I went into more of an outpatient setting, more sports. So one of the only things you can do on deployment, other than whatever your mission is work out. So we had a lot of people injuring themselves, came home, did the same thing pretty much at Walter Reed in the outpatient clinic again, and then had my son. And I got out of the military at that point and stayed home with him longer than I anticipated. And at about 11 months, I went back part-time in a chiropractic clinic. I was the only PT there. We had an acupuncturist and a nutritionist. It was a really, really great setting. We all bounced off ideas.
That's awesome.
On one another. And so that clinic was special because the owner, my boss, he's a chiropractor for the sports teams in DC. So he has,
awesome.
Yeah, he's got everybody. So a lot of our patients were a lot of amateur athletes coming in. So I saw a ton of runners. I mean, everyone in the DC area is super athletic and just crushing life with their sports. So I saw a lot of people with a lot of, just basic injuries. And then, I mean, of course, like most people, most women, they get into women's health when they go through these periods of, having kids and realizing you actually don't have the answers that you need, and you have to go find them because you don't know what else to do. And that's what we were taught in school. You don't know the answer, go find them yourself, go find somebody. So that's kind of what I did. And I just started digging more. And my husband was always like, you can do it. You can find out all these answers. And then I realized after a while too, like, I can, but I also need help. The therapists also need help. I can't give myself what,
it's hard to treat yourself.
I'm not going to find the same things that they do. I can't do the internal exam like they do.
Some logistical issues there.
So, it's just been, and now just learning more about whatever general health topics that I can. It's been an interesting 5 years after I had my son, and then I had my daughter. And those two births taught me a lot about the body, about my body, and then rehabbing that. But it's fun.
Yeah, no, definitely. That's I think you hit the nail on the head. Like, my kids taught me more than I ever learned in any post-grad class, nothing like that. But first of all, thank you for your service. I don't think people realize that PTs do go out and they do get deployed and they do get overseas, and that's hard. So first of all, thank you for that. Second of all, running, how long have you run? Like, why is this your thing?
Yeah, I played soccer through college, and then when soccer was done in college, I was in grad school, quickly realized I needed some outlet. And I started running more on my first longer clinical. I was living at the beach. So I finally didn't have like tons of homework and tons of things to study for. And I had that little amount of time that I could actually do something. And it just kind of kept going after that. And after deployment, so on deployment, I ran a lot on a treadmill for 7 months.
Oh my goodness.
I ran outside maybe 4 times in some races that we had on the base, but you're
a better woman than I.
And came home and did a Marine Corps marathon. I said, I'm done. I'm never doing one again. I made all the classic mistakes that every novice runner does. And
what year did you do Marine Corps?
2013.
Okay.
And then
I did mine in 2004, and I joked that it was my second. It was my first and my last.
Yeah, it was brutal.
Yeah, that's a nice. But
aren't you? Was before kids, so I was also like, I have to do this because I'll never do it again. I mean, I don't know why I never thought that, but
that's so funny. Well, and you were scheduled to do one this year, aren't you?
Yeah. So I got into Chicago.
Oh man,
I don't know. I think I might defer it, and then if they do have marathons, I think I might just go down to Richmond.
Yeah,
close by, and
we'll kind of see what happens.
Yeah,
for sure. So I want to pick your brain a little bit because you've turned me on to some really cool voices, kind of in the running community. Who are kind of the people that you're just getting a ton of information from right now? Like, who are the voices where you're like, you need to check them out?
Tom Goom, of course.
Yes.
I mean, you cannot go wrong with him.
Totally. I was so pumped to see that he collaborated with the UK therapists on the UK guidelines with green and so on. I was pumped.
Yes. That's awesome. So necessary. And listening to the 3 of them talk too on podcasts is incredible because he brings this whole other side of the ortho side of things. And then they're the women's health, and they have really just mashed the 2 together. And so he's great. If he comes out with anything, I'm on top of it. Willie.
Yep.
Is that how you say his name?
I have no idea.
Another great one. Brad Beer.
Oh.
Brad Beer. He's in Australia or New Zealand. One of them.
All the Aussies and the Kiwis are so good. At kind of picking apart the ortho, and I'm such a huge fan and have some great friends down there.
Yeah. So 2 people from my school ended up moving down there.
Oh, cool.
After school, and they had to pretty much like go back through school to get their license and do anything down there. They're good.
Yes.
They don't mess around.
No. One of my one of the best PTs I ever worked with, a good friend of mine, he's now, the Philadelphia 76ers, Scott Epsley. We worked together at Georgetown for a number of years, and he's from Australia. And that's where I picked up.
I met him at a course.
Oh, that'd be awesome. He's just fantastic. I refer to him as my annoying little brother who's smarter than me. Because I'm just a little bit older. But we had such a great relationship because he saw the value of, that what we do as pelvic floor PTs is just so much more than that. But I also was able to speak ortho because that's kind of where I came from first. And so instead of being, you just have, this real estate here, he's like, well, how do you see this stuff? And how do I see this stuff? And how can we make something better out of it? And so it was super fun. Kind of like that relationship you're talking about with your chiropractor, to be able to just kind of pitch in and problem solve and see different eyes. So I'm a huge fangirl on Aussie physios.
There's another one actually I just found recently. I can't remember his name. There's so much now, thankfully, on the internet. I wish they got more visibility.
Yeah, I mean, it's interesting. And that's where I kind of feel like we're almost like translators or conduits or things like that, because you need to be able, we kind of chatted about this, like, even if you follow those people, if you're just kind of a runner off the street or a mom or something like that, sometimes it's hard to figure out how to translate that into what you do every day. And that's where I think we can be such a huge, we can fill that gap because we can speak both languages. We speak mom and we speak, I ain't got time for that. But we also can translate the literature and kind of extrapolate and pull. And that's something that I love to do too, because pelvic floor literature is not awesome because there's no money behind it.
Yeah.
And so we kind of have to take kind of what they did for the UK guidelines, like, hey, this is what we know in return to run after injury. This is kind of what we know about retrospective postpartum data. Throw a bunch of other things together, swirl it up, and let's see what comes out. So we at least have a starting place.
Yeah.
But yeah, no, I'm a huge fan. What are some of the biggest misconceptions that you see out there, kind of more in mainstream?
Oh, got a visitor. You say hi and then you go back up. Okay.
Hey, buddy. Your mom's working.
Can you go back up now? Can you have honey? You can go get it.
This is what your mom is all about. But this guy is why we learned a lot of things.
Go get your honey and go back out with Daddy. Nolan, I need you to go up now.
I don't care.
I know. Go up.
I know how Nolan feels. I definitely know how Nolan feels.
He's a little chatty Cathy. He loves meeting people. So.
Oh, okay, cool.
All day.
Awesome.
Make friends. Nolan, go upstairs.
Some of the stuff that, I'm kind of seeing a little bit. Nolan, you can hang out. I just need to talk to your mom for a little bit. I just feel like there's so much. I feel like expert gets thrown around a lot, and I feel like people are selling one answer, and they're like, "I have the right answer. This is the only answer." And it's so hard sitting back and kind of biting your tongue a little bit because the data is not there. The one that, and this is, there's a diastasis program out there that like, we're clinically proven. I'm like, it kind of takes advantage of the fact that the public doesn't really understand clinical research and even, levels of evidence and those sorts of things. I think that's one of the things that's really hard for me to kind of hold my tongue on.
I think it was Tom Goom had said it in one of the recent podcasts I listened to with him. If someone's going to say that I have all the answers and this is what you need, then you need to go the other way, because we know a lot about healthcare.
Yeah.
But we also know that there is so much we don't know. And then, the research, most of the research studies for return to run and any injury really it's a study of 10 people.
Right.
And most of the time it's 10 young men.
Right.
And
exactly.
Exactly. And then it's getting generalized to everybody, and it's not the case. And there's too many other variables out there.
I think that's hard when you're not in, from a clinical or medical background, because, you think that medicine understands, and we understand all things. I mean, with the exception of like COVID or something like that. But it's like, oh, well, don't you have the answer? And I only think it's been since I've had kids that I've been more comfortable saying to people, you know what, this is what I think is going on, and this is why. If things aren't changing, I need to go back and see what we missed. But I honestly, I'm making my best educated guess on this. Like, I don't know the answer. But that's part of, I think, gaining some trust a little bit from people. because there's nothing worse than somebody promising you something and then it doesn't come out. And then you're like, well, then it's my fault because we're moms and we blame ourselves.
Yeah, we come down heavy on ourselves.
Yeah, exactly.
Yeah, and then even that, I mean, well, I ran through pregnancy. I had an uncomplicated birth, and now I'm going to go back to running, and it's all going to be fine. I mean, we know that is one of the biggest problems right now, and why the guidelines are so important, because it is giving us a little bit more of a control over what we're doing, or something to go off to guide us, because we need it, because that's not the case. And I think that's one of the biggest misconceptions is that, well, I'm strong, I was running then, so why can't I run now, especially if my doctor said I'm fine.
Right? Yeah. No, I about died when I looked up the origin of the 6 week, and literally it was like, well, we used, and ACOG said this, it was like, oh, well, 40 days of convalescence for the mother and her child. I'm like, do-over? I did not get that. Like,
yeah.
no.
Yeah.
So, well, you got a bunch of questions on Instagram, so I'm going to pop them up here and then we can kind of play through them a little bit. So this one I thought was really interesting. What's your take on this? Is there a recommendation for how long or far you should run each month you're postpartum?
I think running postpartum, or as Brianna Battles says, you're postpartum forever.
Yes.
If these symptoms come up, if you have pain, if you have incontinence, if you have the heaviness, any of these symptoms come up when you're running, that is a signal to you that your body is just not tolerating what you're doing right now. And then especially even if maybe it didn't happen during the run, maybe it happened later in the day, or maybe it happened the next day. Those are all cues that we need to be aware of. If you're not having that stuff, just, like a couch to 5K progression where you're walking and then you're running. I mean, it's so individual.
Yeah.
What you're gonna do.
I think so too. Yeah. And I've had some patients that, they want to put in, a 40-mile week, and, maybe they're fine at 30 miles a week. And then that's when they hit the issue. And I think that's the other thing to be cognizant of too. Like there's some women, like it's right off the bat that you're going to have symptoms. There's some, you're not going to notice it until those later on critical thresholds. You've got to hit that mileage before you start to see the deficits and the breakdown and the gaps and so on. So, I think this way, I always say it depends, but like people get mad about that.
Yeah, I know, but it does. I ran New York City in 2018, and my last 20-mile run, I think I went to the bathroom 4 times, and it was the worst run, and I was freaking out. Something's wrong. Like I was okay. I was really teetering on, I shouldn't have been running that much. I wasn't listening.
How were you postpartum?
She would almost a little less than 2 years.
Okay.
So far enough out. But that was the thing. Like I had some symptoms. I could manage most of them. I had an idea of what was going on with my body. I knew when the symptoms would come up.
Yeah.
And then run 20 miles. I mean, it was just too much.
Right. Right. But you didn't know that threshold until you got there, though.
And I did 20 miles 2 weeks before, and I was okay then. So it's.
Well, and I think that's when, there's back to misconceptions. Like, I think people automatically think that like leakage, prolapse, it's all pelvic floor. And it just could not be further from the truth. It's so much more complicated with like collagen and genetics and pressures and how you delivered, and just there's so many parts and pieces to it. It literally is not that simple for a good reason, because if that were the case, we'd all be walking around with our insides outside, and like it just would not.
Yeah. And then the hormonal piece too, like.
Yes, exactly.
And,
yeah.
And I think that was probably a lot of what was going on at that point.
Mm-hmm. Yeah, no, and I was like, I'm missing one. I'm glad you said that. I was like, no, that was the point. That's what she said. All right, I got another good one here. What are your top tips for preventing running injuries in the first few months postpartum? I know what you're going to say too.
Smart progressions.
Yeah.
And being honest with yourself. It seems basic, but if you're having the signs and symptoms that something isn't right, then you need to, take a step back and figure it out.
Yeah.
Because then
they don't know where to go.
Yeah.
You know what to do.
Yeah. Then there's the whole sleep aspect.
Yeah. And you were up a lot last night, right?
I was up last night, and my daughter's 3. It never ends. No, someday it will. Someday.
I'm the last one to ask about that. My oldest didn't sleep the first 5 years of his life, so don't ask me.
Yeah. And so, we know sleep is tied to increased injury risk. We also know nutritional deficits. If we're not, if our intake's not high enough and our energy expenditure is too high, if we're not recovering because we're not sleeping, if we're really getting out there and hitting the roads, then that's when we can see bone stress injuries.
Yeah.
So
that one really hit me a lot, especially with this kind of social pressure to get back. And get back. That honestly, when I'm talking to women, that's either the first, second, or third thing that comes out of their mouth is about their weight. And, well, I can fit into this, or I can't fit into this. Like, that's literally, it's not about why they're there. It's, well, I'm here, but this, which to me, like, it's heartbreaking in some ways that that's the first thing that they think about. But I also very much understand that because I've felt that way too. Yeah. I know that, like, I'm not in white skinny jeans all the time, and that's purposeful.
Yeah.
But it's just one of those things that I think it's constantly, we know about it cognitively, we understand it, but it's always kind of hanging back there. It's always part of the conversation with moms.
Yeah. And I wonder too, if I had a harder time with that with my first than my second.
Oh, interesting. Okay.
I just knew, I knew it would go, I would get back to where I would prefer to be.
Yeah.
And it would just take time.
I was the opposite. My oldest literally ate my butt. I had no butt. But he also ate a lot more. We had a miscarriage in between, so I gained a little weight there, never lost it, and then had my daughter on top of that. And then life, of course. So it's funny though, when I definitely feel like no matter whether the first was easier or the third was easier or whatever, like, they're all a little bit different. They're never the same. Never the same.
Like any other surgery. If people always compare I got my first knee done, and now the second one.
Exactly.
The first one was really bad, but I'm like, you can't. They're different. They're totally different.
Definitely. This question I thought was kind of a good kind of progression from the last one, because strengthening, I think, is finally starting to come into its own. I literally just this morning, I don't know if you've seen it, Chris Johnson, who's Zarin PT, he just put out, and I didn't understand it for a second, it's a cinder block workout. I'm like, wait, what? And it literally, all you need is a block of concrete. And you use it for resistance, you use it for step up and step downs. Yeah. But he literally has a introduction, an immediate, kind of intermediate, and a advanced, I think it's like a 12-week strengthening program for runners. And I was like, damn, I bought it as soon as I saw it. I'm like, I want to know what you got in there.
Yeah, I'll have to look that up.
It literally just came out like in the last week, I think.
Yeah, the strengthening is interesting. I got Jay DeSherry's book, Running Rewired. So he has, I mean, he's got the same tons of exercises and kind of programs in there that are running specific.
Yep.
Because we know time is valuable, and a lot of times runners, you know, the only way they want to get, you know, they think that they're going to progress and get better is if they run, and that there is a lot of truth to that.
Oh, totally.
But there's, you know, the whole other system that we need to focus on too. But to make sure that you're doing the exercises that are actually going to benefit what you want to do.
Yeah, that's where I think, again, us as kind of translators, because we get the whole, I would rather be running. Somebody put out a program recently kind of asking a question of runners, you know, should you run with diastasis or something like that? And she's like, well, you know, I know how runners are. They're kind of like 3-year-olds. You tell them not to do something and they're going to do it anyway. And I was mildly offended by that. But nonetheless, with runners, like, I think if you give them something, it's kind of like talking to moms. If you give me something that's going to give me results, like if you give me something that's going to make me faster and less likely to be injury prone, I'm down. But it needs to be in a very kind of repeatable, concise, not take a ton of extra time. Like I don't think it's that much different than asking a mom to do a program. So that's why I literally think being a mom, especially, you know, you're in you're in it right now with the little ones. But like, you have to, like, gun to my head, like, I need 3 and go, and that's it. Like, no more, no less. And if you ask me to do more, I'm not going to do it.
Yeah. Yes. I have been on, since this whole quarantine, really, I think since last year. I hurt my heel in the summer jumping with the kids. And since then, I had been focusing more on strengthening, and it is such a challenge. I mean, the time I want to run, and that does come first.
Yep.
Then squeezing and strengthening on top of whatever I'm doing with my kids and my family, my husband, our friends. Like, it's hard, but I think one of the easiest things to do is if you have 3, like you said, 3 or 5 exercises that you focus on that are going to hit some of those main groups, and it takes 15, 20 minutes, then I mean, that's better than nothing. And
totally. For I think for moms too, especially, like, that's such a great place to start in that first 12 weeks before the clearance, is to get started on that strengthening, because you want to do something. And if that just means that once you get started, you're not going to put yourself at risk for injury. Like, can you imagine going 12 weeks, you've waited, and then you hurt yourself right off the bat, and then you're down for the count again. But for me, like, the bigger issue is if you hurt yourself, then you can't run after your kid at the park who's going to try and run into the street and get hit by a car. Like, to me, there's kind of that survivability stuff too. Like that's, yes, running is super important, but I also need to keep track of the small human.
Of course, last year when I hurt my heel, my husband had to go out of town for work.
Oh man.
I was on crutches. I took them to the park, to a new park has like 4 levels, and I'm looking at my daughter. I can't get them, and I was so frustrated.
You're like, I can't get there.
Guys, come down.
Yeah, totally. We've got two last quick questions here. This one, should I warm up and cool down with pelvic floor exercises?
I'm going to sling. I mean, warm up and cool downs are certainly important. Again, I think it just depends on what you're doing. Some pretty quick, easy exercises that are going to just get your body, like, realizing that you're about to move instead of just heading out the door and going. It's certainly helpful. I mean, and you can talk more about to sit there and do some Kegels.
Yeah, I mean, I that unpacks a whole like bunch of stuff that implies that the only thing to do is a pelvic floor exercise, which actually most of the women that I see that have leakage when they run shouldn't be doing pelvic floor contractions to start. They should actually be working on the relaxation piece.
Yeah.
So if anything, if those muscles are overactive or underactive, obviously start with what you need. And if that made absolutely no sense to you, definitely check out my Instagram because I talk about it all the time. But lots of times if I have people do a workout or a run or something like that, and there is overactivity, I may have them just make sure when they finish, like just lay down, put your legs up the wall or up a tree or up the side of your house or something like that, and just let everything kind of take the time to come back down, and that becomes your cool down. If you work on activation in the beginning, it may just be to like proprioception for your brain to be like, hey, these guys got to wake up or something. But Kegels for Kegels' sake, again, there's a lot to unpack there, but maybe having something, if you don't know how to integrate your pelvic floor exercises into your program, whether it be relaxation or contraction, maybe that's a good kind of space and place because kids are going to leave you alone. I don't know.
I mean, I think that goes along with the whole misconception about running too.
Yeah.
Program is, I only have to do that and then I'm okay. But there's the floor, there's the diaphragm, there's the abdominal, there's the back. And it's not, you can't isolate one because they're never isolated when you're running.
Right.
So you have to work them together and coordinate them.
Totally. All right. One last question here, and then we'll do a wrap up. This one I actually get all the time. Should I wear a belly band right after the birth or skip it? Did you wear one after either of your kids or no?
I didn't. No.
I did after my second, only because I had C-sections for both my kids. My first was like 3-day labor, like swelling. I tell the whole story. I had to send my mother-in-law to Target to get me new underwear because my thighs would not fit through the leg holes. That's how swollen I was.
Yeah.
These are
I was quite swollen after Nolan.
It's not fun. So I, with my she's my youngest. I was like, wait, which one is she? Because they didn't have all those garments then, and she's 6 now. I ended up finding a high-waisted lymphedema garment. So the compression was pretty high, and I literally felt like I was stuffing a sausage. But it helped me kind of get that swelling down. But there came a certain point where I'm like, okay, I don't really need this anymore. But it wasn't for any muscle things or whatnot. It was really just for the swelling. And I clearly have issues with that with both kids. I can't imagine doing that in summer. Like this was like fall, winter. It's like an extra layer.
Yeah. I mean, we want to get the swelling down.
Yeah.
As quick as we can. And if you have a lot, you can imagine that it's not
fun. And I had nerve issues and stuff with it, with the compression and whatnot. So yeah, I wouldn't recommend it. All right. So if you had to say one thing to a new mom, let's say she's been, a runner her whole life, and this is her first kid. She just had her kid a couple weeks ago. She's kind of coming out of the darkness a little bit, and she's looking forward towards running. Everything that you know as a mom, as a PT, as a vet, as everything, what would be one thing that you would want her to kind of take away from all this?
Wait. Sleep.
Ah, that's a good one.
Sleep. I know. It's like you want to get back to running because it is where you feel the most normal in a really new and uncertain situation. Every mom you talk to gets that. But I mean, it just, from what little evidence there is, we gotta wait, and find a therapist. Find a therapist to look at you.
And you found a therapist too. The helper got the help. I've gotten help too. Like, it's important.
I found someone out near me, and I won't go into specifics, but I knew she just wasn't for me.
Mm-hmm.
And then I found someone who was great, but I couldn't keep driving an hour out there,
Yeah.
an hour, and driving back an hour. It was taking up such a big part of my day. And then I did find someone finally down the road from us, thanks to you. But it's, yeah, I mean, it may take a couple therapists to find someone you mesh with too.
Yeah. I think somebody that understands running, I think is important. Just like, you know, finding somebody that understands, you know, what it's like to be a mom with a couple of kids and not give you 17,000 exercises and make you feel guilty if you didn't get to them. No, and I think if you're not getting that, that doesn't mean it's your fault. It's important to know what you need. You may not know where to find it, but find the voices that resonate with you, because if you have that icky feeling like this isn't working, that's not the right path, and that's okay. There's enough variation amongst PTs for better or worse. But yeah, and I think that's where, honestly, for me, all of this pandemic stuff has actually been hugely eye-opening, because clients have found me who wouldn't have been able to find me otherwise, but have been open to, you know, because they don't have to drive 2 hours or something like that. There's so much that we can do virtually and watch them run and talk through symptoms. And so if you can't find that, if you haven't found it yet, if you're not feeling like you're getting better, like, there's options out there for sure. So awesome. All right. Well, thank you so much for coming on. I will post in the captions Lisa's Instagram handle. It's dr.romanzo-runs, which is what I almost wanted to call you today. I'm like, no, this is what your name is.
Lisa. Yeah, I know.
Tell Nolan thank you. We borrowed his mom for a little bit. And I can't wait to kind of keep following what you're doing. And if you want to know how to do selfie run photos, she's also your girl. So you have amazing graphics and stuff on your gram. So I love it.
Thank you.
Thanks so much for coming on, and I'll see you on the gram.
Yes. Bye, guys.